Jamie Tarpley,
And I'm Ashley Wojcik.
and we're going to talk today about Dorothea Orem. We chose her because she used her own background to define nursing, and her theory was adopted by bigger organizations to develop nursing curriculum. One of her quotes that we wanted to share was, "What human and environmental conditions exist when valid judgments can be made that individuals are in need of nursing as distinguished from other forms of healthcare?" She has quite an extensive background. She developed one of the most grand nursing theories that can be applied to all aspects of nursing. Her theory guides nursing in providing the best care possible. She was born in Baltimore, Maryland in 1914, and she died June 22nd, 2007. She earned her diploma from Providence Hospital School of Nursing in Washington, D.C. in 1934. She earned her B.S. in nursing from Catholic University of America in 1939. And she earned her MS in nursing education in 1945 from Catholic University of America. Her career, she earned several honorary doctorate degrees. In 1976, she earned the Honorary Doctorate of Science from Georgetown University. In 1980, she received the Honorary Doctorate of Science from Incarnate Word College. In 1988, she received an Honorary Doctorate of Humane Letters from Illinois Wesleyan University. In 1998, she received a doctorate from the University of Missouri in Columbia. And then in 1992, she was named an honorary fellow of the American Academy of Nursing. And as far as her work history, she started her early years in nursing practice from 1934 to 1936 at Providence Hospital in Washington, D.C. She also worked there in 1942. And then from 1936 to 1937, she worked at the St. John's Hospital in Lowell, Massachusetts. From 1939 to 1941, she taught biological sciences and nursing at Providence Hospital School of Nursing in Detroit. 1945 to 1948, she was the director of Providence Hospital School of Nursing in Detroit. 1959 to 1964, she was the assistant professor of nursing at the Catholic University of America. In 1964 to 1970, she was associate professor, and then she became the dean of the School of Nursing from 1965 to 1966. She had several accomplishments. The main one was she developed the self-care deficit nursing theory between 1959 and 2001. She was the author of several papers. She spoke at conferences, workshops around the world. She published her own book titled Nursing Concepts of Practice in 1971. The book outlines her theory of nursing, and the book's currently in its 6th edition. She was the chairperson of the Nursing Development Conference Group. In 1973, she edited their work and their book, Concept Formalization in Nursing. The self-care deficit nursing theory is also known as the Orem model of nursing, and this is the idea that patients will recover faster and holistically by providing their own self-care as much as they're able to do so. Orem identified the concepts of nursing and the relationships between the concepts to formulate her theory. There's 3 categories, according to Orem, of self-care requisites, which include universal, developmental, and health deviation. If any of these requisites are not met, then a self-care deficit occurs. The universal requisites are needs that everyone has, such as water, air, food, activity, rest, and hazard prevention and promotion of function, or otherwise called ADLs, activities of daily living. These needs are affected by age, developmental state, life experience, health, and available resources, life processes. The needs promote human function, promote hazard prevention to well-being in life, and promotes a balance between solitude and social interaction, between activity and rest. The developmental requisites are subcategories, maturational and situational. Maturational is where the patient progresses to a higher level, and then the situational is associated with developmental processes or events and preventing harmful effects from occurring. An example would be like adapting to a new job or body changes resulting from a disease or condition. The health deviation, patient needs that arise are based on their condition, illness, or injury. And if a patient cannot meet their need, a self-care deficit occurs. This requires seeking out care, awareness of the condition, and tending to it, following through with prescribed care, learning to adjust to the condition, and self-acceptance. The theory of self-care deficit specifies when there's a need for nursing. Nursing is needed when a patient is unable or limited in their capacity of providing care, and the 5 methods according to Orem are acting for, doing for others, guiding, supporting, providing an environment that promotes growth to assist in meeting future needs, and teaching. The nursing systems theory would describe how patients' needs will be met by the nurse, patient, or both, which is composed of wholly, partly, or supportive education systems. The nursing process prevents a method to determine self-care deficits and a need for nursing. And the nursing care provided is considered the technical portion of the nursing process, which should be coordinated with the following processes: social or regulatory.
We think that Dorothea Orem is a leader because she took what she learned in various healthcare settings and applied it to her own theory of how she viewed nursing as a practice. She made her own path, and using her unique qualities, we think that is something that a leader should have. She dove into many subspecialties and continued her education to further her own theory-based nursing. Orem dedicated her whole life to finding what is the basis of nursing on a theoretical level. She separated nursing from other healthcare specialties, providing data that nurses have their own body of knowledge. Orem used a multi-step approach to assess the patient on a holistic level, assessing bigger than just the specific disease present. The assessment went into detail of the client about everyday living and how nurses can adhere to their needs. She clarified that when a deficit is present, then the nurses can step in, creating boundaries. Orem used her scientific background to develop a nursing conceptualization, which is used in everyday nursing due to her self-care deficit theory. By her process of self-care, she can teach other nurses the scientific approach to nursing. Orem used the same goal as the Nursing Development Conference Group, which is to provide rationales using the scientific basis for all the patterns and interventions we do as nurses. We can apply this to our student learning outcomes because she developed a program for curriculums. Some rules are as follows: introduce baccalaureate and associate degree students to nursing as a discipline of knowledge and to nursing-related disciplines. Design and develop a curriculum using a valid general theory of nursing as a curriculum framework. Use the theory to identify and clarify views of society that are specific to nursing. Some more rules are: use the theory of nursing to make explicit nursing value, domain key concepts and systems of symbols or language, show the relationship of nursing to the other human affairs, design models for developing the dimensions of each of the characteristics of nursing. It should serve as a tool for organizing current nursing knowledge. It provides boundaries for the development of methods and inquiry and thought systems. It serves as an intellectual tool to maintain a nursing perspective. It should foster confidence in the nursing student who is facing new and different nursing experiences. Orem has inspired many and ourselves to pursue her own definition of nursing. She used her science-based approach to develop goals and new innovations for nursing students who are learning in the nursing profession. She provides guidelines and many rules to further create better nursing programs and outcomes for patients. With her guidelines as a reference, we can apply her frameworks to our own curriculum while we are still in the baccalaureate program. Self-care deficit is an issue that is pretty universal when it comes to the continuum of care in the clinical setting. Her theories provide us with the backbone to look at patients in a holistic manner and approach them with great understanding of the issues at hand. Thank you.